we're here today to really discuss how digital innovation can be part and parcel of overcoming some of the key health challenges that some countries in the continent face. We even have a healthcare entrepreneur from the DRC with us today. So we're going to be talking about those concrete solutions. And in our discussion today, you can expect to hear a lot about how to fill in the healthcare gaps that exist in a really concrete way, as well as the global perspective on digital health and where this sector is heading. We're going to also be speaking about the specific healthcare challenges that we can identify across the continent, developing tailor-made solutions to improve access to quality healthcare. And also we will have the benefit of looking at the legal perspective of this topic and issues around managing data use. I'm going to quickly introduce each one of our speakers. Before I do, I want to make you aware that we will be compiling questions using the Slido tool. So I do encourage you to visit www.sli.do in order to contribute your questions and vote on the winning ones. Use the event code ABCSolve. You don't need an account to join that as a participant. And we'll be going back to those questions at the Q&A session of this webinar in order to put those to the speakers that we have today. We'll also be including the link to Slido in the chat box on Zoom. So if you can refer to the Zoom group chat, you'll see that it is being shared there. So as I was saying, let us introduce our speakers. So to help us answer the burning questions that I was talking about, we have Josephine Agaman-Dua. She has several years of work experience in healthcare and scientific research, including leading national interventions to reduce mortality rates among under fives in several developing countries. She's also worked for the Global Fund. In terms of academia, she's been a visiting lecturer at the University of Heidelberg in Germany, where she previously studied, as well as gaining her undergraduate degree in biochemistry from the Kwame Nkrumah University of Science and Technology, Ghana. Josephine, I'm going to ask you just to say hello to our participants.
Hello, everyone.
Hello, welcome, Josephine. Josephine's going to be speaking about the healthcare challenges in Africa. We also have joining us for this webinar, Frank Lievens. He is the Managing Director of Lievens, Lankman and Acromed. Both companies are involved in the manufacturing and distribution of medical devices within a worldwide network. He's also the Executive Secretary of the International Society for Telemedicine and eHealth, the management board there. And he's going to be speaking about the direction or towards digital health, really the global perspective on digital health. Frank, I'm going to ask you to also welcome our participants to the webinar.
Yes, hello. Yeah, here I am. Everybody, glad to be able to join tonight. And there's a
We had a bit of trouble hearing you there, Frank. Welcome to the webinar. It's great to have you on. Hopefully the connection will be a bit better once I turn my screen and my sound off. Then we're also going to be speaking to Jose Zefu Kimpalu. He is an entrepreneur with a 15-year background in biotech and the medtech industry. In 2016, he co-founded WapiMed, a Congolese startup that aims to develop digital solutions for better access to quality healthcare in the DRC. His latest solution is called MedPay, which is a healthcare payment platform enabling the Congolese diaspora to support their relatives in the DRC. Jose also owns a consulting and management company in the USA. Hello, Jose. Thank you for joining us.
Hey, hello everyone. I'm glad to be here and looking forward to this webinar. Thank you.
Brilliant, thank you. And last but not certainly no means least, we're joined by Jan Klink. He is a lawyer at Altius. He specializes in various aspects related to data protection and new technologies in different sectors such as health, media, and retail. He's also has a profound knowledge of ICT and intellectual property. Welcome to the webinar, Jan.
Good evening. Thank you for the introduction. Looking forward to this meeting.
Brilliant. Thank you very much, Jan. And he'll be speaking about digital health in Africa, the opportunities and challenges in the use of data. So everybody has been introduced. The program or the agenda for the webinar is that we're going to be hearing from each speaker, and then we'll have questions and answers afterwards. We are going to start with Josephine, who is going to be presenting to us on the healthcare challenges across the African continent. Over to you, Josephine. Thank you very much.
Thank you. My topic is on advancing healthcare in Africa through technology. So I've worked in Ghana and some countries in Africa, mainly on maternal and child health and quality improvement methodologies. And so this presentation is really to talk about how we can use technology to address some of the healthcare situations or challenges in Africa. And so next slide on advancing healthcare in Africa, the universal health coverage. So the universal health coverage mainly says that anyone, everyone, whoever person is, should be able to access healthcare when and where they need it, and the healthcare should be of good quality and should not, that means that should not cause harm to the person whilst accessing the healthcare. And there should not be financial damages to the person whilst accessing healthcare, because if that means that it should not be expensive for the person, it should be affordable to whoever is accessing healthcare. So there are three main dimensions of universal health coverage. That's equity in access, quality of health services, and financial risk protection. So in this presentation, I'll discuss how technology can be used to help us in Africa to get closer to attaining the universal health coverage throughout Africa. The next slide on the state of health in the African region talks about how the WHO African region measures the state of health in Africa. And if you look at the statistics, it shows that access to health services, from promotive health services to curative and treatment, we only access up to 48% of health services for like on average in Africa, which means that in all 6 dimensions of availability of essential services, coverage of essential services related to the SDG 3, and all health security, financial risk protection, the coverage for Africa is 48%. And to be able to get closer to a universal health in Africa, what we need is technology to help us closer. So my next slide is on global strategy on digital health. That says that the purpose for a global strategy on digital health is to promote healthy lives and well-being for everyone, everywhere, at all ages. So the time is really ripe for us to use technology or mHealth or digital health to help Africa to get closer to the universal health coverage. And I will use an example. So that's so the SDG 3, I'm on slide. Yeah, so I'm moving to the next slide on digital health in the context of Africa. If you look at digital health, there are 3 main tiers that the WHO wants to let us focus on. So if you look at the digital health statistics, it shows that at least 87% of the member states of the UN, they at least implement one type of mHealth strategy in their country. So, but then if you also look at how mHealth has been practiced in Africa, you see that there are lots of health interventions and projects that use mHealth to promote health services, but we don't really have a national or an integrated mHealth approach in the mainstream healthcare delivery. So we need policymakers to really integrate mHealth as part of the way that we provide services in Africa. It's happening, but it's not integrated fully as part of the health system in Africa, or how to deliver health services. In terms of practitioners, yes, we do have people, a lot of practitioners who use, let's say, mobile phone or have computers to transmit information, like telemedicine, like, and also like there are various types of using digital health to in the practice of healthcare. There are practitioners who are really abreast with the status quo and able to use all these services. But then there are also challenges, the know-how challenges among some practitioners. So there's an example where in one of our sites where we worked, they institutionalized the health information system such that if you go to one unit in a hospital, your information is shared electronically. So by the time you get to the consulting room, the doctor has access to your lab results and you don't have to take it manually. But it so happened that on the day they started working on it, they didn't train all the staff. And therefore, the purpose of institutionalizing an e-record system to reduce waiting time, rather increase the waiting time, because the health workers, some of the health workers who were supposed to be abreast with how the technology was used were not too familiar with it, and therefore they spent time trying to familiarize whilst patients were waiting. So if we want to go the way of mHealth, that means that apart when policy makers make it part of our health system, we have to train health workers to be abreast with the technology in use. And then population-wise, too, people have to accept what it is. It's sometimes in our part of Africa, it's not everyone who will agree to that. Okay, my doctor calls me and wants to have a video call with me. We'll say that, no, this is not good healthcare. I have to sit in front of the doctor who touches me. So we have to make sure that the population also appreciates or understand the importance of mHealth in promoting healthcare. The next slide. So I'll zoom in now to the application of digital health to promote maternal, newborn, and child health interventions in Africa. So if you look at the SDG 3, target 1 and 2 says reduce maternal mortality, and the 2 says end all preventable deaths of children under 5. Now, in Africa, the top 5 causes of mortality includes maternal mortality. And why would a woman die? Sometimes a woman will die because maybe there's high blood pressure in pregnancy, so monitoring is poor. If the woman doesn't go for antenatal service, they are not able to monitor their blood pressure. And we know that in almost every home in Africa, there is a mobile phone. And there are apps that help people to track their blood pressure, for example, even for pregnant women to document the history of their pregnancy, the observations. If we have these institutionalized as part of the way we work in Africa, or provide health services to pregnant women, they will be able to, one, identify danger signs early enough to be able to report to the health center. In the situation where the woman lives far off from the health center, if mHealth is institutionalized, the woman can just call to the midwife and say that this is how I feel, this is what I feel, am I in labor, is this good, this is what is happening to me. Then the woman can at least have some advice from the midwife. And so when we institutionalize mHealth or digital health in Africa, it will really help to reduce a lot of the maternal mortalities that we see. In terms of child health, so I've put some pictures beneath to show some of the interventions or platforms that have used mHealth in the delivery of health services to mothers and children. So in the second one is the picture from the Oxy Life project in Oxford. So where they empower through virtual platforms, they train health workers in the management of emergency services for newborns. And through that, they're able to save lives. So this project is being carried out in Kenya, where they watch a video and there's a health professional who is out, like not in a facility, but when there's an emergency, they're able to call and give directions as to how the health worker should care for the baby. And it's also a training platform. And this also shows the picture of a midwife who is showing the pregnant woman, the antenatal nurse showing the pregnant woman how to document or record hair observations during pregnancy, and then healthy dieting during pregnancy.
We are going to have to wrap up your section very, very soon. So you've got about 1 more minute. Thanks.
Okay, so the next slide on opportunities and challenges. Having said that mHealth is essential in the delivery of health services, we have to watch out for funding. Who is funding the mHealth interventions? Because it involves money. And training, as I mentioned, if we don't train the health workers, you can bring in the best of strategies or mHealth innovations, but it will not give us the expected results. Data protection, and I'm sure the other speaker will talk about legal side of data protection, who controls the data, who can have access to the data, governance, as I've already mentioned. So although there are opportunities for us to use mHealth to promote care, there are also challenges as to how they are now, like who is funding it, how they are regulated in the country. So my key message is, the last point will be that mHealth is not an add-on to healthcare, but it's an integral part of the delivery of quality healthcare to help us to achieve the universal health coverage in Africa. And digital health is only one of the many efforts needed to address healthcare challenges in Africa. There are a host of others: health education, health promotion, empowering looking at also socioeconomic factors. And then we have to conduct research to see the impact of these digital innovations going on. Yes, we've seen early signs or results that it works, but on a national scale, there's little research that shows the national impact of these mHealth interventions in Africa. And then, yes, so that's my key message, that yes, it's useful. It should not be seen as an add-on, but an integral part of healthcare delivery in Africa. But then we have to also watch out for the governance of it and do some more research to know the impact at large scale of this of digital health in healthcare outcomes. Thank you.
Brilliant. Thank you so much, Josephine. I think it's really interesting that you not only highlighted how it can help us, but actually there are some of the underlying issues around like training healthcare workers and governance that are totally actually kind of separate, but the basis for really bringing to the forefront these digital healthcare solutions that can actually make a difference. So thank you very much for that. I think her leaving remark is it's not an add-on, but a central part of delivering universal healthcare coverage in Africa. Next, we are going to take it in a more global direction. We're going to look at digital health from a global perspective and the direction it's going. I'm going to hand over to Frank Lievens to discuss a bit more about digital health. Thank you. Frank, the floor is yours. It seems that we don't have Frank either on the line at the moment. Maybe he's trying to reconnect. In the interest of time, I will move on to our third speaker. So Jose, you've just been bumped up to second position for now until Frank comes back. So as I said, Jose is an entrepreneur. He's going to be speaking to us about developing tailor-made solutions to improve access to quality healthcare in Africa. The floor is yours.
Yes, thank you. So again, hi everyone. Very, very happy to be here. It's a pleasure. It's an honor, to be honest. So, no intro. Intro has been, done very well. So basically, myself and my team are really in a, let's say, in a venture to making, improving quality cares in emerging countries a reality. So the previous speaker just, explained it very well. With the digital solutions, we really have an opportunity to come with, solutions that will help patients, care providers, but also, governance, right? And that's what we try to do. Let me take over the control here. And let me check if it works. Yeah. So basically, we started with the first idea. The first idea came from a situation. I was back, in the country, Congo, with my son, and I realized that, okay, if this guy is, getting sick or hitting a wall, where should I go? And you always have people telling you, oh yeah, I know someone, you can go there and there and there. But when it's someone that you love, really, like your son, someone close to you, to yourself, you want to make sure to have the right decisions, right? And that's how came the first idea of developing, a solution that exists elsewhere. It's basically a geolocated directory for care providers where you can find valuable information about, the care providers. Where is he located? He or she, sorry. What is the specialty? How can I get, connected to that care provider? Coming back to Belgium, where I was living at that time, I decided to start that with a friend of mine. And that's how came the first solution, which is WAPIMED. And basically, it's just a way for people to really get access to kind of very important information that you need to have handy when you have a situation, right? Whether it is someone who has the malaria since few days, doesn't feel well, but you want to connect with someone that is basically vetted, because that's also an issue that we have in some of our countries in Africa. Let's be honest about that. We have real doctors, and we do have doctors that are not really real. And so you want to make sure that you knock on the right door, right? So that's how we decided to work and to move forward, leveraging the fact that the adoption in Africa for digital technologies is just strong, right? It's strong, it's increasing. People have smartphones, not older the population, yes, sure, but there are ways you can internet technology with regular phone, like, USSD, things that basically in the banking we are using since years. I don't know if you realize that, but the banking industry in Africa is maybe the best one when it comes to including people in the banking system. We have been using regular phones, GSM, like we say in Belgium, to transfer money from one person to the other, across the country. So that's really the mindset that drove us at that time, and we started with WAPIMED. Then come, another idea. Being part of the diaspora, born in Belgium, raised up in Belgium, connected with Congo, going there often, moved on now in the US, I realized that, the diaspora has an issue. When we need to support our people, basically we need to send money, and we do that because we love our people, right? We want to make sure that our auntie or uncle is doing well, and we are working hard to get some money and sending the money in the continent. But there is something wrong here in that process. Well, we are often lacking the visibility, how the money is being used effectively, right? You can send $100 or 100 euros, and 50 euros hands up to the bar, or $20 hands up to whatever else. And at the end of the day, the person who really needs that money to get access to quality care, well, doesn't really benefit of the money, or partially. And so that's the reason why we decided to increase that transparency, to increase that, trust that you have in that process. We do have good care providers that, they have the knowledge. Maybe they are lacking some of the equipment, but at least, there are people that are doing the job correctly. And so it means that also for them, you want to make sure that they get the reward of doing the job correctly, so meaning being paid. So we realize that, okay, on one hand, we have the patients who needs to access quality cares, and sometimes it's not feasible because, at the end of the day, the money that you receive is not enough to go to the right hospital. And on the other hand, you have a care providers who needs to have that money also to make sure that he can run his facility and also invest in his own equipment, in the assets that he has, right? And me, as a person from the diaspora, I want to make sure that basically the money that I'm sending is really used for that purpose. And we develop a platform which is just more than just payment. It's really an integrated solution where we are providing that visibility. How do we do that? So basically, we are just, providing some benefits on the different stakeholders. When I say stakeholders, we really see care providers are a part of the problem, the person sending the money are the other part of the problem, and the patient who needs to benefit and access the quality care are also another part of the problem. So on the MedPay platform, basically, we are just providing the information to the person sending the money, how much does it cost really to get access to a general consultation? How much does it cost to get a blood sample? So that person has visibility into that and is fully confident that, okay, the money that I will be sending is effectively enough to cover, for example, just the first consultation. On the other hand, from a care provider perspective, he wants to make sure that he can have the money handy when he's treating the patient, or at least when he treated the patient or consulted the patient. Well, with MedPay, when you do the payment or platform, it's a prepayment. So you send the money, but it's held on a wallet on our side. So we are working with the fintech company in Africa holding the money. And we put in place a process where you will have to send some information to the patient. And when the information are transferred to the care provider, that's only at that exact time, that the money is moved from the wallet, MedPay wallet, let's say like that, to the care provider. So what are the benefits? First, for the care provider, he knows that when a MedPay patient is coming, he will get the money. He will get rewarded in a way for the work that he's doing, which is also important for him because, again, he has some staff member, he has a facility to run, he needs to invest in equipment. So you want to make sure to have that money. And we all know the stories. We all heard about the stories of people getting to the hospital and not being treated because they are waiting the money coming from Western Union, from someone who sent the money or elsewhere. So that's what we try to solve from a care provider perspective. And from the patient perspective, well, when you're sick, you should just focus on your illness and just go to the hospital, right? So you shouldn't think about whether I need to go to an office to collect the money, I need to travel there. So that's really where we see also value for the beneficiaries. So just go to the hospital, everything has been sorted out, just take care of you, and the rest will be handled. So that's really, in a nutshell, what we did with MedPay. We did a pilot phase with an hospital in DR Congo. It went well. We are now in the phase where we are kind of ramping up the marketing and the effort to target the communities to let them know about the different stakeholders about the solution. COVID is not helping, but we believe that as soon as things are getting better globally, we could start again this effort. And we really see, and really the feedback that we receive is really positive, encouraging, and that's really where we believe technology can also be very helpful. The previous speaker mentioned that, the World Health Organization said it very well in 2010. In Africa, technology offered the opportunity to really help people to have better access to quality care, and also, starting from there, also to build an ecosystem. Today we have WAPIMED, we have MedPay, we have many other ideas that we can, put together and then really create that ecosystem, leveraging the digital solutions where healthcare providers will also start to communicate each other, right? Yeah. They will also start to share patient data, taking in consideration all the requirements about data protection, how you want the data to be secure, whether it is in the cloud, whether it's locally, etc. And I think that the next, one of the next speaker will talk about that. But there is really things that we can do and help the continent to do better and to help people to get better access to quality care.
Brilliant.
So
Thank
what
you
about
so
our
much,
team?
Jose.
We are six, let's say 6 people in.
Hello, Jose.
In the company, we are registered in Congo, but also in the US. Myself, Steve,
Jose,
Ray,
do you hear me?
We are the tech guys. We have MD, medical doctor, Randy, based in Belgium. And we have Daddy, also based in Congo. And we have two advisors based in the US. One is very well
Jose,
focus and
I'm going to have to cut you short. Yeah. I mean,
okay. So that's basically my last slide. We have been part of the Tonelo Melu program in 2017. and we are part of an incubator in the new city in Congo. Thank you very much for your attention, and yeah.
Thank you. Thank you for your contribution. Really interesting to hear not just one business idea, but actually building a whole ecosystem around digital healthcare solutions and introducing transparency into the process as well. That's something that we haven't spoken about yet, but this is a very interesting addition to the discussion that we've had. So thank you very much. We're now going to go back to Frank for his presentation about the kind of future of digital health, or where it's going from a global perspective. So I'm going to hand over quickly to Frank now. Frank, are you there? If you can turn on your video and mute yourself. We've lost you again, I'm afraid. Frank, you're frozen. Let's give him a few more seconds to see if he'll come back. If not, we will have to go on to our, well, not final speaker, but on to Jan and discuss with him about opportunities and challenges in the use of data. Okay, we seem to have lost Frank totally. Frank, it's very, very disconnected. We can't hear a word that you're saying, I'm afraid. No. Okay, for the moment, we will go on to our final speaker and then see if we can integrate Frank at the end, because at the moment, I'm really sorry, Frank, but we cannot hear you at all. I'm going to introduce now Jan Klink. He's a lawyer at Altius. He specializes in various aspects related to data protection and new technology. And he's going to talk to us about the legal point of view, which we've raised a few times throughout this discussion. I'll hand over to you, Jan. Thank you.
Thank you, Uzo. Good evening, everyone. So I'm Jan Klink. We're going to have 10 minutes about legal challenges in Africa when talking about digital health. So if we're talking about digital health or telemedicine, what are we actually talking about? We have seen a couple of examples in the previous presentations. Of course, we're talking about healthcare services. Healthcare services between patients and a healthcare practitioner, but also often it's focused on the relationship between a consulting healthcare practitioner who is having a face-to-face consultation with a patient and a servicing healthcare practitioner who is delivering his services from abroad. If you see, for example, the ethical guidelines that are used in South Africa, they are mainly focusing on the relationship between the two healthcare practitioners and with which rules they have to comply with. Of course, digital health and telemedicine means that we are going to use electronic means, ICT solutions, to provide our healthcare services. This can be through a network, a smartphone, laptop, video conferencing. So there are numerous possibilities to provide these services, all with the same goal, namely replicating the face-to-face consultation. Often there will be a face-to-face contact between a nurse, for example, and the patient, but who is calling upon a third party, another healthcare practitioner, to give input on the health condition of this patient. Opportunities in Africa are, of course, numerous. First of all, healthcare access in underdeveloped rural areas is a big problem. When introducing these technologies, these new technologies and solutions, it provides those people in these areas with a much easier contact to doctors. They don't have to travel that far. They can maybe use doctors from abroad, from other countries, from other continents. So it's opening up a market for specialized healthcare services. On the other hand, it will also reduce costs and expenses, and that will address inequality between private and public healthcare services. And as I said, it will give also the opportunity to have a faster contact with specialists. So you don't only have to go to the generalist who is located in your village, but you're going to have an offer of multiple healthcare practitioners, maybe international experts, if you're having a rare disease. Some cases to put things a bit more concrete. First one is the Unjani nurses. I don't know if anybody has heard about this initiative, but it's an initiative in South Africa, which has been developed by a group of nurses who are going to implement container clinics in rural areas. And there they were having the face-to-face contact with the local people, but through teleconsultations, they were providing to those patients much more sophisticated services, healthcare services, than they could apply themselves, these nurses. And so it was based on a cell phone-based electronic health record management system, and it improved increasingly the healthcare in those places. And this concept started a couple of years ago and was very fast picked up by an enterprise in the US, the What If Health platform. And they are now helping these nurses to further develop their idea, to further develop this concept by providing a more sophisticated platform to, for example, store the electronic data that is passed through the system when there is a contact between a doctor and a patient. Another example is the That Health Again application, which is an application that started by a Cameroonian enterprise and which provides all people who are going to register this on this application to have in real time a consultation through your smartphone. So just as we are having a consultation right now, a webinar, if you're having a very good internet connection, which is often the case in Africa, this will help you to have faster and easier access to a doctor and to doctors that register with this application. And so it enables a lot the threshold to go to a doctor and to go to a specialist if you're having these specific problems, specific health issues. Because there is no need to travel, you can select the doctor that you want from the application. A third example is much more closer to home. It's a Belgian example, and it's from the enterprise Sodire, which stands for the Solution Diagnostique Radiologique. And so these are experts in radiology. And the idea started when they had to help out French hospitals who were encountering problems or shortage problems of radiologists. So they were providing from a distance their expertise with these French hospitals. But soon they further developed this idea, and they started in, for example, Congo with assisting hospitals over there. So through remote controls, they were going to provide assistance not only for directly to patients located in the hospitals, but also to train the staff over there to use sophisticated equipment. So here again, you see, for example, that the telemedicine is not only focused on the patient-doctor relationship, but also between doctors, specialists, and hospitals from abroad. As a fourth example or a fifth example, I could also show the WapiMed application from the previous speaker, but I think that everybody has right now an idea on what is the telemedicine. Of course, this comes with challenges, and certainly from a legal point of view. And to give you just an overview, I've made 3 categories to give you an idea of, okay, what are we talking about and where are the legal problems or the legal challenges that someone has to find a solution for. Of course, we're dealing with multiple parties. We've got the patient, we've got one, two, or multiple doctors or healthcare practitioners. We, of course, also have an app provider, so the one who is providing the application, which is a party that is not involved if you're having a face-to-face contact with a doctor. And of course, because we're talking about healthcare, the government is also involved. This brings us to a second category, namely regulation. Which regulation have to be applied with? Where do we have to look if we're going to regulate digital health, telemedicine, whatever you want to call it? Of course, applicable law will be the first question to deal with. We're often in an international context. For example, if you take back the Saudi Ray example, you have Belgian doctors who are providing services to hospital in Congo, maybe for a patient that is who has a South African nationality, and so you immediately shall see that this will bring up some questions about which patients' rights have to be involved. Are these the patients' rights from Congo, from South Africa, from Belgium maybe? If it's a Belgian healthcare practitioner, does he only have to apply with the ethical standards from the national Belgian Doctors Federation, or does he also have to comply with the one in Congo or from South Africa? So it's getting very complex. Of course, because we're also talking about electronic communication, security will a very big issue to handle with, because everything is going through smartphones and through the internet, maybe using cloud services or other digital platforms. So, of course, because we're talking about patient rights, about healthcare, the obligation of secrecy that has to be complied with by doctors has to be assured, of course, because otherwise there will be no trust in the system, in the application that you're launching, if a patient knows that everything that he's telling through his smartphone to his doctor will be out in the open on the internet, for example. So you have to deal with strong security issues like encryption or pseudonymization of the data. And of course, a secure area where you can store and archive these data. So in general, data protection will be an issue. If we're talking about data protection, in Europe, this mostly brings up the flag of the General Data Protection Regulation, the GDPR. It's not because we're talking here about how the situation is in Africa that this would exclude, for example, legislation like this General Data Protection Regulation. For example, when we were dealing with a case for an organization here in Flanders, who were encouraging a first aid project in a country in Africa, they were getting data from the participants in this project in Africa to use it for scientific purposes. And so they were wondering, well, do we have to provide these people with a privacy policy, for example? Do we have to inform them that we, as an organization, will be dealing and will be processing their data? Or is this all something that has to be dealt with under African law? And is this something for the organization in this country? And so we had to find a way to make our organization comply with this regulation. The same will go when, for example, a software application from France is launched in Africa. Also here, the app provider will possibly have to comply with the EU regulation. This all to give you just a short overview of the challenges from a legal point of view that there are when dealing with telemedicine and digital health in Africa.
Brilliant. Thank you so much, Jan. I feel like when I popped up, you realized that it was about your time to wrap up. Brilliant. Thank you for that. Really interesting presentation, especially if we think about the different digital components that there are in these digital health solutions, and that they might not just be based on the continent, but often bits of the technology are global and they're having to share data globally, and that obviously has implications for data protection, as you rightly have outlined. Thank you so much for that contribution, Jan. I'm reminding people to ask questions on Slido and vote for their favorite questions. We're about to get to the question and answer, but we are going to see if we can get through to Frank so that he can make his presentation on you know, kind of the future of digital health. I see that actually he won't be able to join. So unfortunately, what we'll try to do is see if we can either share the slides, get him to maybe record something to send to you. Really sorry about that. I mean, these are the signs of the times. If we do things live, internet connections do get a bit wobbly. So let's go straight to the question and answers. We have the most popular, well, we have quite a few top ones. I will start with the question for WAPIMED for Jose. Jose, a few questions for you. Firstly, around what role did you play during the current crisis in terms of WAPIMED? How did the technology, or how was it used specifically in a pandemic context? And then how many people are using your platform at the moment?
Yeah. Okay, regarding COVID-19, so what we are doing right now is basically all the care facilities that are, how to say that, designated by the Ministry of Health as COVID-19 treatment facility are listed in WAPIMED. So we try to expedite the identification of the place where patients or people who think they have symptoms should go. And the idea behind is indeed to avoid people to potentially contaminate care centers that first cannot treat them, take care of them, or do the test. And secondly, well, you know, if you go to a place where they cannot test you, but unfortunately you are in contact with other patients that are already sick, and there, well, you are just participating in the dissemination of the disease. So that's the first thing that we try to do on our end. The other thing that we did in the beginning, we developed quickly a chatbot, Facebook Messenger chatbot, to help people to understand whether they are at risk, either because they recently traveled or they had someone in their environment. And sorry for the background, but my daughter is not so far away.
No problem.
And so we try to come with such solutions and you know, quick fix, let's say, like that, quick tweaks to help people. One challenge though is that, you know, in some countries, and I will refer to Congo, they decided to work with different type of structures, and they decided to designate specific companies to work with, right? And so we were interested to work in that dynamic and to propose our expertise, but for whatever reason, they decided to build everything again from scratch, what was kind of a bit sad, because we felt that we had everything ready kind of to leverage, but this is the way it is. So I think we are trying to do the best we can on our end, also to leverage our social media, maybe to communicate, we did a live Facebook 2 weeks ago. We have Randy is MD. So Randy is from time to time doing some articles that we are publishing. So that's kind of things that we try to do at our level.
Yeah, and
that was the first question.
That was the first question, and that also picks up on we'll be going back to Josephine in just a moment, but Josephine's point around involving, you know, policymakers in this process of deploying digital health technologies, especially when there is something like a pandemic. So the other question was around how many people are using your platform. And what is your action plan and roadmap for coverage across the continent? I'll give you 2 more minutes for that answer. Sorry.
I had some Google Analytics numbers yesterday. Let me just quickly look at So regarding WAPIMED, so performance. So we had, I think, less than 16,000 impressions, 3,000 people so clicking on the website, kind of looking for something. And then I think, for example, one of our key metrics, so people are looking for l'ordre des médecins in Congo, so people want to reach out to the medical order for whatever reason. So that's the type of thing that we are monitoring. About our expansion. So today, WAPIMED, we are listing care providers in 7 different countries. We are trying to update when feasible, but it's not easy because we are basically working from scratch. Our intention with MedPay is to deploy MedPay in West Africa, because I've been talking to different people in the US, and we believe that the West African markets could be a little bit more mature than maybe other regions to welcome such a technology. So that's kind of the plan that we have right now, working on expanding in West Africa. And in fact, also, we are working on a WAPIMED 2.0 version that will be live maybe end of this month.
Very interesting. And I want to now go over to Josephine, because we have a question around speaking to your expansion in the West African region, because it is a bit more mature. It probably somehow starts to answer the next question, which is, in your experience, what are the countries that are the most advanced in health technology on the continent, or health technologies in the continent?
So the question is, which countries are the most advanced in health technology in the continent? Okay, so there are different dimensions of mHealth, application of mHealth in Africa. So some look at, let's say, health promotion services, for surveillance, for data transmission. So it depends on which aspect, but generally, the more advanced countries would be like South Africa, like in terms of mHealth, and countries who invest a bit more in healthcare. So generally, from my findings, generally within Africa, like we are below like 40-something%. And but the interesting thing also I found was that, for example, mobile phones, the use of mobile phones to send reminders or health promotion messages is like there was about 80% coverage in West Africa, which was quite impressive compared to like Southeast Asia. Like this, the averages for Africa was quite high, and that was quite impressive. But in terms of the country, I can mention South Africa. I'm not really sure. I cannot really mention, make a comparison of the other countries, but I know South Africa stands out. And then on the average, at least, health promotion, mHealth for health promotion is quite high in Africa.
That's very interesting, especially because you say it's actually more related to those that are investing heavily in healthcare. And actually, I thought that maybe it might be those countries heavily investing in digital, and then, you know, there's a quick crossover like Kenya. But actually, we need to invest in health itself in order to get these technologies off the ground and for them to be really developed on the market. That's very interesting. Thank you, Josephine. We have also a popular question for Jan. We're going to head over to speak to Jan now. And it's quite a detailed one. So how do the pricing models work with these digital companies like Moderator? Do the Congolese practitioners pay Belgian high prices? So are Belgian practitioners, or are Congolese practitioners paying, you know, Belgian prices in order to access the service?
Well, I don't know how Moderator is dealing with the payments of its practitioners, of course. But what I do know is that, of course, because you're dealing with this specific kind of services, some extra cost can come into play. You're not only delivering your healthcare services, but also delivering often an IT solution, which should be implemented, for example, in the local hospital. You have to maintain these electronic data that you're receiving from this hospital. So this can bring up some extra costs that are, of course, not to deal with when we're just having a face-to-face relationship. I don't think that they will charge the Belgian prices for the local practitioners, and that this will be just a contractual arrangement between the hospital and the Belgian company.
Thank you for that. I'm going to ask one more question, and I'm going to go back to Josephine on this one, just because it's more of a Pan-African question and a lot about access, which you've talked about, especially population access and some of those hurdles. So somebody is asking about the access to ICT and the marginalization of women when it comes to access and digital rights, the fact that they might not be able to access those technologies. How can we try and reach those populations with digital solutions if they do have limited access?
Okay, thank you. So that's why it's important to have intersectoral collaboration. So it's not only an issue for health service providers, but for example, for the telecommunication services, you can, since it's a targeted program at, let's say, women, they can decide to make those services free, like sending text messages or calling your midwife. It could be free because they can give some codes where you can access or send messages for free. And then there's also another school of thought where people advocate that mobile phones should be made less expensive, like mobile phones for the transmission of audio or video information related to health. They should produce them in quantities or in make the cost accessible for poorer people. So I would say that intersectoral collaboration where health service providers link up with telecommunication and also, let's say, the cost of sending messages or using the platform for messages should be made free for targeted health interventions, especially for women in poorer regions.
Yeah, brilliant. Okay, thank you. And I guess it's to your point, and to actually Jose's point around, making local solutions that fit the challenge is incredibly important in this context. I mean, we're using digital technologies from all over the globe, and we understand that, to Jan's point in terms of data protection and looking how we manage those types of risks. But it's really important that the solutions really speak to the local challenges on the ground and those circumstances as well. We are officially at 8:09, which means that we have like less than 30 seconds until we finish this webinar. We've obviously not been able to answer every single one of your questions. I'm sorry about that, but I'm sure if you follow up with the Africa Business Club and see if they could direct those to some of the speakers that we have had on the webinar today, they might be able to facilitate that. Otherwise, I've just made a promise that they can't keep, and I'm absolutely sorry about that, but I'm sure they will be helpful. So we've talked a lot about, the key challenges in terms of getting individuals on board and learning about how to use and interact with digital technologies, but also healthcare workers, making sure that they're trained and they understand their responsibility and remit for really delivering these healthcare solutions for patients. We've also talked to Jose, who's presented to us a really comprehensive solution that includes the diaspora, that includes transparency, and that really makes sure that the patient can concentrate on getting well, and the doctor can also concentrate on his job, which is treating the patient, and not worry too much about where the money's coming from or how it's going to be transferred, which for many of us in the diaspora, we know that that's a huge headache. And then finally, we've heard from Jan, who has talked us through some of the data protection issues and some of the IP issues that we need to start thinking about when accessing and when deploying digital healthcare technologies across the continent, especially as we live in a globalized world and a lot of the components are not just being formed or being produced on the continent, but are quite often being produced elsewhere. So a huge thank you to the Africa Business Club for setting up this digital webinar. We all know that it's not easy, but we've managed it and we've had some very interesting conversations. I also want to say a big thank you to the participants. Thank you for joining. It's an evening and a Thursday evening, so we really appreciate you taking the time to come and listen to the conversation. And obviously, thank you to the sponsors, the McKinsey & Company and Altius lawyers.